Hi, it's Christina from the Sisyphean Journal, and today we're looking at the second of 3 deaths that were attributed to Dr. Justin Mitchell of Chicago. He was convicted of manslaughter in the April 3rd, 1935 abortion death of 32-year-old Mary Nowalowski. 11 days before his conviction, so apparently he was free on bail while he was on trial, another one of his patients named Alice Hagen died of abortion complications. 2 years earlier, he'd been implicated in the abortion death of Mary Schwartz. Now, the prime witness in Mary's case was a milk wagon driver named Stephen Zakes. He and Mary were planning a wedding for the upcoming May. On March 27th, Stephen brought Mary to the Chicago office of Dr. Victor Neal. He met with the couple together, telling them that Mary was about 2.5 months pregnant. Mary began to cry and asked Dr. Neal, "What will I do?" Now, Stephen, the fiancé, testified that Neal referred them to Dr. Justin Mitchell, whereas Neal insisted that he had simply told them they could go to some busy corner and find an abortionist. So, big fat load of help Dr. Neal was. He didn't provide any real assistance. And I'm not saying he should have done the abortion. I'm just saying, he could have said, "Oh, you can have the baby when you're on a honeymoon," and lie about how old it is. Or, okay, why don't you secretly elope? Nope, just find an abortionist. So Stephen and Mary went to Mitchell's office on the evening of Friday, March 29th. Mitchell examined Mary and verified that she was indeed pregnant, and she was at least 8 weeks along. If she returned the following morning at 8 o'clock, he would perform an abortion for a $50 fee. He assured the couple that there was no danger for Mary to undergo the procedure. So, Mary went in bright and early for the abortion. Around 11 o'clock, Stephen came by to see how she was doing, and Mitchell said, "She will be all right. She's in a little pain right now." Stephen went to see Mary for himself and found her to be in excruciating pain, unable to even sit up. Mitchell insisted to him, "They are all weak after an operation of that kind." So Stephen escorted Mary home. She was weak and chilly. They stopped at a drugstore for coffee and toast, then walked to a cab stand where Mary became violently ill. After Stephen took Mary home, she immediately took to her bed. Dr. Neal was summoned, and he examined her and provided morphine for her pain before leaving. Stephen remained with her until about 1 o'clock the morning of Sunday, March 31st. Now, somebody, I haven't been able to find out who, brought a Dr. G.M. Redmond to Mary's home between 4 and 5 o'clock that morning. He found Mary in such grave shape that he immediately took her to his car and drove her to the hospital. There, Mary was given medicine to contract her uterus, but she continued to bleed. So Redmond contacted the coroner's office to let him know that an abortion death was pending, but then still tried to save Mary by performing a curettage. Her cervix had already been damaged, showing tearing and pus. And during the curettage, Redmond retrieved the head of Mary's fetus along with retained portions of the placenta. And those of you who are horrified and going, "Oh, if only abortion had been safe and legal," this is a fairly typical type of complication you would see in a safe and legal abortion too. Redmond's care notwithstanding, Mary died on Wednesday, April 3rd, and a post-mortem examination concluded that Mary's uterus had developed gangrene due to the abortion, and she died of hemorrhage and septic shock. So, again, this is the same kind of complication you would see in safe, legal abortion deaths. I really don't think you can blame her death on the legal status of her abortion.